Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers, ladies and gentlemen. Dr. Mohammed Al-Sheef, your host of Elixir of Life, kicking off another inspiring and informative episode with our distinguished guest, aiming to explore new frontiers and bring you most up-to-date information related to health. Our program is filled with many inventive and stimulating segments. However, the most important segment is our episode theme, swallowing and communication disorders, with our distinguished guest, Ms. Reem Mallawi. Stay tuned for a special episode. Please don't go away. Once again, welcome back to Elixir of Life. Our next segment is the quote of the week. To watch more details about this report, stay with us. Once again, welcome back to Elixir of Life. Our next segment will be Health, Myth and Fact. To watch more details about this report, stay with us. Don't go away. Once again, welcome back. Our next segment will be medical news. To watch more details about this report, stay with us.
Assalamu alaikum wa rahmatullahi wa barakatuh. I am Mohammed Nizami, Senior Speech Language Pathologist. I would like to welcome you today for our Awareness Day of Communication and Swallowing Disorders. In this day, we aim at improving awareness for families and parents of the signs and symptoms of speech and language disorders, so that we have early discovery of speech and language disorders. The family can play a good role in this part. In fact, I would like to talk about our Sound of Life program. It is a cochlear implant program where we deal with severe to profound sensorineural hearing loss. Those children who cannot hear any sound, we do a pre-cochlear implant assessment. Then, if they don't have benefit from hearing aids, we go for cochlear implant. After that, they go through a 4-year rehab of oral rehab and speech and language rehab. Then they will catch up with their peers in their hearing and language skills.
Hi, this is Iwan Abu Sulaiman. I'm presenting the interactive area in the Awareness Day. Welcome to the Awareness Day, and the idea is that people will come and they will stick the characters. Each character represents a section, and they will attach it hand by hand to emphasize the meaning of communication. Thank you so much.
Assalamu alaikum. My name is Noor Al-Rashid. I'm a speech language pathologist at King Fahd Medical City from the Communication and Swallowing Department. Today we have the Communication and Speech Language Pathology Awareness Day. Here we have the Kids Corner. We have different activities. First we start with the face painting, and also we have the playing activities, basketball and darts. We also have make your own superhero cape and drawing corner. We also have the Find the Treasure corner, where we can give some kids questions for them to go around the booth and find the correct answer. The purpose of our corner is to help the mothers and guide them to facilitate language acquisition through playing, and for the kids to enjoy their time.
Bismillah ar-Rahman ar-Rahim. My name is Muawiyah Abu Sharaf. I'm a speech language pathologist here in King Fahd Medical City. We are trying to give the visitor and the family here experience to see what the patient is suffering, and like we have here like activity how to tell the family to deal with their kids. It's like to change the way of dealing with them rather than traditional way, to keep it in an attractive way, and to make it more effective, and to let the patient or the kids more interactive in the session, and even at home.
Right now we have some toys here, or some to go to. Can you tell us about them?
Okay, this one you can see we are trying to shift the child brain from learning techniques. It's about to change tell the kids you are here to learn, and at the same time you are play. Not only learning, it's about how to encourage the child to engage in the activity. Here, the child will think he's trying to make a fishing, and he will take one picture from here, and then he can see what it is, what it's exactly, and he can name it now. He think he now doing fishing, but actually we are shifting his mind from in the learning techniques to let him participate more active in the activity. And here we have memory games. You can see I can ask you to save as much you can in a few seconds, and you can save as much you can. Then I will ask you some question. It depends where you will focus, and then the answer will be. Here there is a mental activity. If you can do like a pyramid, you can. It's a little bit difficult. Most of the normal people cannot do it. I will do it quickly. It's like this. And here you can see what the difference. It's about focusing strategy. You can ask the child or the patient what the difference between two pictures. Those two pictures. It's a little bit complicated. It takes time, sometimes from person to person to do the task. Some person will take minutes. Some of them will take 5 minutes to see the differences between this. And like this, you can see what expecting inside this bag. It can improve the patient and or the kids' imagination. Can imagine inside, and then we can see how it will work.
Once again, welcome back to Elixir of Life. Now we are coming to the most important segment of our program. Is our episode theme is swallowing and communication disorders, and it's my great pleasure and honor to welcome my distinguished and esteemed guest, Miss Reem Mallawi, is a speech therapist at King Fahd Medical City. Welcome, Ms. Reem.
Thank you, Dr. Mohammed. It's my pleasure to be in your episode today. Thank you.
It's our pleasure. Without further ado, we'll start by asking the first question. We heard about outstanding awareness day about swallowing and communication disorders last week, and you were one of the organizing committee member. Could you tell us more about this day?
Yeah, so basically it was the Communication and Swallowing Disorders Awareness Day held in KFMC. It was about 2 days from 9 to 3 p.m. The main goal or aim of this awareness day is to raise awareness of our profession as speech therapists or pathologists and audiologists, to speak to the public and the healthcare professions about what do we do exactly with the patients.
Excellent, indeed. And people, they think physicians only work in hospital, but there are many important healthcare professionals like speech pathologists. We cannot function without them.
Yeah, we the nice thing about speech therapy or audiology is that we deal with different subspecialties in the hospital. We deal with improving quality of life instead of like the physicians who deal with life-saving issues. So we always collaborate with ENTs, neurologists, internal medicine, and all types of subspecialties.
So you add the flavor to the patient life, okay?
Yeah.
Excellent. Who were the target audience for your awareness day?
Okay, so the main target audience were patients, families of patients, and also physicians, because we work in a hospital-based setting and we receive referrals from all different specialties. So it was important for us to speak to the physicians so they could know exactly what we do. So when they have patients in their clinics coming to them and they complain of a certain issue that's related to us, they know when to refer to us. And also families to raise awareness so they could detect if there's a communication or a swallowing or a hearing issue from an early age for their kids. They can act quickly and fast and come to us, so we could focus on early intervention instead of waiting for all those years to pass and then we start targeting the communication problems.
Very beautiful. Indeed, awareness is the best prevention. Being aware about the disease, and this will prevent the complications and late diagnosis. And what are the methods of health education conducted at your awareness day?
Okay, so in our department, we have 3 main units: audiology unit, speech therapy unit, and the swallowing and voice disorders. So we tried to mimic that in the awareness day. So we had 3 main booths for audiology, swallowing, voice disorders, and the language and speech for adults and pediatrics. So the main goal was to be approachable for the public and for the physicians. So we had 3 main booths, and all the therapists were standing there. We had models like these models and videos, screens behind us showing all of the assessments and interventions that we do. So we basically showed the public and the physicians what do we do on a daily life basis with the patients. And they had a chance to ask all the questions. We had some physicians coming to us and asking us, when do we refer to you? I have this case or I have that case, and we don't know when exactly to refer. So that was really nice. And also we had families and parents asking about how can we approach you. So that was the main essence and goal of the awareness day. Excellent. To just be open to the public and they could feel that we are approachable and we could answer their questions easily without waiting for 2 months to get to our clinic or 1 month for a waiting list.
Yeah, you are organizing this important awareness day every year. Yes. What's new this year? What make this year is very special and different from the previous years?
Yeah, so you're correct. We do it every year. Maybe this year we had a new section which is called the Try Me section. If you could see in the report that you had, there was a booth in the middle where it was more interactive with the public. It was called a Try Me booth. So basically we let the visitors experience what patients feel in our clinic. So if you notice that we had a device called the VisiPitch, so we allowed the visitors to speak through the mic and they could visualize their pitch and loudness of their voice. We also had another section for the swallowing where they were able to taste different consistencies and taste the barium, which is a substance that we use during a procedure for evaluating swallowing. So that helped the public or the visitors to experience a little bit how it feels like to be a patient who has a swallowing disorder, for instance, and has to change his diet or be deprived of a certain taste or flavor that he likes, and changes his diet to something that's not really nice. So that, and also in the audiology section, they were able to test their hearing. They had a screening hearing in that booth as well. So maybe that was different this year. Also, we had, if you notice, there was an artist with us. So there was a live interactive art board that allowed the visitors to stick some of the characters that we had in the board and sticking it hand to hand. That conveys our message, which is communication.
Excellent.
Yeah.
Very beautiful. How was received by the public, all these attractive methods?
Yeah, hopefully they liked it. We had really nice feedback from physicians and public that they felt we were approachable, we were able to answer their questions. Also, we had nice feedback from physicians that they said it was the first time that we know that you do this kind of service, like for instance, voice therapy. They didn't realize that we do the service in the hospital. So it was really nice for us to see that reaction. Yeah.
I think this, amazing and successful awareness day, behind it a great teamwork. You must have been working for a long time to come up with such enormous success.
We had a great team, and I really would like to take this chance to thank them, because we understand that we have a full load of patients during the working hours, and we had to make time to arrange this. So I really like to thank the team that organized this awareness day.
Excellent, beautiful.
Yeah.
This is just introduction to our topic. Now we start the first important question. What's speech therapy?
Okay, so a speech therapist would be able to evaluate and manage any difficulties when it comes to speech, language, social communication, sometimes cognitive, voice disorder, swallowing disorders. So all of those things come under the scope of practice of a speech therapist. We can work in a hospital-based setting, in a school-based setting. So any person who has difficulty in their speech, language, communication, voice, or swallowing, they can come to us.
Okay, so 3 domains major: swallowing, voice and
speech and language.
Speech and language. Excellent. And we have to understand before that what's the normal swallowing process, the mechanism behind it. Okay.
Okay, so
if you could demonstrate.
Yes,
in the
of course, sure. So if we look at this is a lateral view of the head and neck. So they always say that the first phase of swallowing starts when you smell the food, or when you start knowing that there's food cooking in the kitchen. That's the first stage of swallowing, because your body starts preparing itself for food. You smell the food, you look at the food, and that's the first phase. The second phase, it's called the Oil Preparatory Phase, which is preparing the bolus, or the oral phase, let's say. It's basically preparing the food.
If we could zoom to the, okay.
Yes, so basically preparing the bolus of the liquid or the food in the mouth. It requires teeth to chew the solid foods. It requires the movement of the tongue to make a cohesive bolus. And then the bolus starts moving until the end, the base of the tongue. That's the first phase, which is called the oral phase. The second phase, the pharyngeal phase, it's a involuntary phase. So the moment the bolus reaches,
control it, means
we can't control it. Yes, the moment the bolus reaches the base of the tongue, the swallowing trigger happens, and it starts, and it happens in few seconds. There's several steps that happens, muscle movements, and it needs coordination of muscle and nerve innervation for, let's say, the soft palate to go up, the epiglottis to innervate, for the airway protection to happen. So we need airway protection to happen in order to for the bolus to move safely and goes towards the esophagus without something entering the airway.
Excellent. That's sometimes during swallowing we have choking. Maybe you could demonstrate to us what does it mean choking, okay? That's
yes. So basically, if any difficulty happens in one of those steps, we will call it a swallowing difficulty or dysphagia. In the pharyngeal phase, which is here, if a small part or the whole part of a bolus enters the airway, the normal self-defense mechanism will happen, which is coughing or choking. So choking itself is not the aspiration. Choking is a reflex, like what you said, or a self-defense mechanism, that there's danger happening, that there's something going inside the airway. So if something goes inside the airway, we will call it aspiration. And that's what mainly why physicians, and especially in the hospital-based setting, they refer the patients to us, because they want us to diagnose and rule out if there's anything happening in the pharyngeal phase and going a bolus going into the airway.
So what's below that, like esophagus, is not your area of domain or specialty?
It is a part of the one of the phases of the swallowing. Yes, we do look at it, but it's mainly under GI management.
Sure.
So if there's reflux, if there's an issue with the upper esophageal sphincter, if we see that the bolus is not moving, the peristalsis movement, let's say, in the esophagus, that's where we notice it, yes. We say it's part of the swallowing, one of the swallowing phases, but we refer it to GI for medical management, yes.
Excellent.
So as speech therapists and specialized in swallowing, we focus mainly on the second two, which is the oral phase and the pharyngeal phase.
So this brings us to what's a swallowing disorder, okay?
Okay, so similarly like what I mentioned, in swallowing disorder, it's basically a difficulty in one of those phases that I mentioned. So it's either a difficulty in the oral phase, which is difficulty in chewing the bolus, difficulty in moving the tongue in order to make the bolus cohesive, difficulty in moving the tongue in order to move the bolus from the beginning of the mouth until the base of the tongue. All of those difficulties, if you see a patient who's drooling, difficulty in closing their mouth on a cup or on a spoon, that's all going to be under the oral phase, which is called oral dysphagia. If there's any difficulty in the pharyngeal phase, that's when we say it's a pharyngeal dysphagia. Aspiration we notice that there's aspiration happening, or there's after the swallowing, after the bolus goes through the passage and goes through the stomach, we still see some residues or amounts of food staying here in the pharyngeal phase. That's called pharyngeal residues, and that's considered also a part of pharyngeal dysphagia.
Excellent.
So the main issue is that we always want to ensure that the patient is taking orally safely, meaning that we want the patient, if he takes orally, there's no complication happenings out of that. That's where we come into place. If there's any aspiration going into the lung, that's when we have to look into other options.
The most feared, complication is aspiration, pneumonia.
Yes.
And how common swallowing disorders? Are they rare or common in our community?
You will be surprised that it's more common than we think. There's no certain number or statistics here in Saudi, but we can say that it is common. If we look at stroke patients or neurological cases, high percentage of them will have dysphagia or swallowing difficulties. If we look at head and neck cancer, ENT cases, high percentage of them will have difficulty in swallowing. GI difficulties as disorders, they will also have swallowing difficulties. So we receive a lot of referrals from different specialties. They end up having swallowing difficulties.
I think this is a hot area, for research. I
Yeah.
think this is one of the unmet needs that
Yes.
we need to do research maybe in your at least your local hospital to can assess the commonality or prevalence of
Yeah.
swallowing
You're
disorders.
giving me tips for research now.
Sure, of course, we can collaborate in this. Okay,
Right.
what are the common causes of swallowing disorders among adults and kids?
Okay, so as a speech therapist looking into dysphagia or swallowing, we see children from the age of newly born until the age of 80 and plus. So we see that age range. Regarding kids or infants, if they're premature, they might have a feeding difficulty because their feeding skills are not acquired yet. We see in children if they have developmental problems, neurological issues, respiratory problems, they will end up having difficulty in feeding. Regarding adults, it might be acquired or developmental as well. Acquired, for instance, like traumatic brain injuries, they will end up having some type of dysphagia. Head and neck cancer, stroke patients. So all of these diseases might result as a complication. They might have a swallowing difficulty. So basically, dysphagia is not a disease on its own. No one is diagnosed with dysphagia alone without having any difficulty. So usually it's a result or a complication of a main disease or disorder.
Yes, it's
Yeah.
like a symptom of
Yes.
a disease or syndrome.
Yes.
Now I think we are, what are the clinical features of swallowing disorders?
Okay, so the clinical features, basically, if we look at the different phases, the first phase, the oral phase, we will look into drooling, we will look into if there's any weakness in the oral muscles, which is the lips, the jaw, the tongue. How is the patient managing the bolus? Is he able or she is able to masticate? Is she able to move the bolus in order to swallow it? So that's the first phase. The other clinical symptoms for the pharyngeal phase is like what you said, choking, throat clearing. If a patient would drink water and then we notice that he's throat clearing, that might be an indication that he might aspirate. Also, vocal change. Some patients, after they swallowed, you will notice that their voice changed. That might be an indication, a strong indication that he's aspirating. So not necessarily the real obvious reaction, which is coughing, that it must happen. Sometimes it doesn't happen. You would see patients who are perfectly fine, they drink and eat normally, and then they get admitted for aspiration pneumonia or lung infection because there's foreign material going into the lungs. When we do the assessment, we notice that they are aspirating, but why they don't have any reaction. We call it silent aspiration, and that's one of the main things why physicians refer to us to detect if the patient is having silent aspiration or not. Mainly because they are aspirating, but there's no obvious reaction in the bedside. So those are the main clinical symptoms.
So the cough is reflex is good. It will alert us that patient is at risk of aspiration. If it is without cough, it might be more serious, as you have pointed out.
Yeah, some research say that a cough reflex is not the only aspect or the indicator, but yes, mainly we would look into that. If all the clinical symptoms for the patient and the reason of admission tells us that the patient has complications because he's aspirating, but in the bedside nothing happens, that's when we need to continue investigating to rule out silent aspiration or prove it.
Excellent. Which is more difficult to swallow, liquids or solid?
Nice question. It varies depending on the case. So if a patient has oral dysphagia, meaning that the patient has real weakness in the muscles of the oral phase, which is the tongue, the jaw, it will be difficult for him or her to chew solid food. So in that case, solid food will be more difficult, and the liquids will be easier for him to manage because it needs minimal movement of the oral muscles. But let's say if the patient has weakness or difficulty in the coordination in the pharyngeal phase, that means the liquids will be more difficult because he will aspirate with it easily than the solid food. So it depends on the case, really.
But more commonly we see with
Commonly
liquid.
with liquids, yes, especially thin liquids, which is like water, like juice, like tea, like coffee. So there's different thickness and consistencies. We call it consistencies for the liquids. There's thin liquids like water. There's thicker liquids like mango juice or cocktail juice. So some patients will aspirate with the water or thin liquids, but they are safe to take thicker liquids, depending on the case again.
Very beautiful, Ms. Reem. The question that comes up after history, physical examination is how to diagnose swallowing disorders.
Okay. So diagnosing swallowing disorders, first we start with bedside assessment. We go into the patient's room after reading the medical chart. We kind of have an indication when we speak to the physician and know what's the reason of admission and what's the main diagnosis. We can't predict, but we might be wrong as well. So in the bedside, we start assessing the patient with different consistencies or different thickness of liquids and food, and we observe the reaction of the patient. We observe if there's coughing, if there's change in vocal quality, if there's throat clearing, if the patient is complaining of pain during swallowing, discomfort, those signs, and taking the history. Sometimes we can be perfectly happy with just the bedside, and we can allow the patient or not allow the patient for oral feeding. Sometimes we need to go further into instrumental investigation. That's when we need to visualize the swallowing itself. We have two different assessments, instrumental assessment. One is called the Modified Barium Swallow Study. It's a fluoroscopy, like a video, exactly looking at the lateral view of the patient and giving the patient a bolus of barium, which is like a white colored contrast material, yes. And we observe the behavior of the bolus. Literally, we look at the bolus, where is it going, and we do observe the aspiration or not. Or we do the fiber optic endoscopic evaluation of swallowing, which is like a nasendoscopy. And also we give the contrast or a blue color, and we see if there's any aspiration or not.
Excellent, very beautiful, Ms. Reem. Now we will go for a report about Swallowing and Communication Disorder Awareness Day. To watch more details about this report, stay with us. Don't go away.
In case of sound waves striking the ear, they pass through the canal to the eardrum. From there, the sound waves are mechanically transmitted to the inner ear and amplified. In the inner ear, you can find the cochlea. The cochlea consists of 3 different canals. The middle canal is the organ of hearing and consists of sensitive hair cells. The hair cells can be stimulated electrically and forward the signal to the nerves and then onto the brain. In most cases of deafness, the hearing nerve still remains functional, but the hair cells have been damaged or even lost. In a cochlear implant system, sound enters a microphone and travels to an external mini-computer called a sound processor. The sound is processed and converted into digital information. This digital information is sent over a transmitter antenna to the surgically implanted part of the system. The implant will turn the sound information into electrical signals that travel down to an electrode array inserted into the tiny inner ear or cochlea. The electrodes directly stimulate the auditory nerve, sending sound information to the brain. Bypassing the damaged inner ear, The cochlear implant provides an entirely new mechanism for hearing.
Once again, welcome back to Elixir of Life, and it's my pleasure to welcome again Ms. Reem Abdulaziz Mallawi, speech therapist. Welcome,
Yes.
Ms. Reem.
Thank you.
We've been, discussing swallowing disorders, and we, after passing through the diagnostic modalities, now we are coming the most important segment: how to manage swallowing disorders.
Okay. So managing swallowing disorder is basically depending on the case. So we can't say that there's one managing method that we do. It's really case dependent, depending on the environment of the patient's home, of the medical diagnosis, is it progressive or not, the family members that's with the patient, the safety, of course, of the oral feeding or not. So after we do the assessment, and we, for example, we notice that the patient is aspirating with one consistency, which is thin liquids. What we do is we modify the diet. Why would the patient be deprived of taking everything orally while the patient is only aspirating with water or coffee, let's say? So we could use other methods, which is thickening the liquids. Sometimes we use a powder called thickener powder that would be added to the thin liquid. It will just increase the viscosity and make it thicker for the patient to take orally safely.
Is it available in the pharmacies or stores, or only in?
It is available in our hospital. Mainly, we prescribe it.
Prescription,
but but they take it from the dietitian department. I think it is available in some of the private pharmacies. Let's say. Yes. So we always try to keep the patient on anything orally. We don't want the patient to be deprived of taking oral feeding, especially the coffee. So we try to modify the diet. If the patient had severe pharyngeal dysphagia, which meaning that the patient is aspirating with all the consistencies, with all the liquids, even the food, that's when we go drastic with our management and we tell the patient you're not allowed to take anything orally, and we think of the alternative methods of feeding, which is tube feeding. Sometimes the patients are temporarily on tube feeding or temporarily on modified diets, and we try to intervene and we do some therapy. Sometimes we do oral motor therapy exercises, meaning that it's like the concept of physical therapy, but for the swallowing muscles, the oral and pharyngeal muscles. Some of the cases they benefit from the intensive therapy. Some of the cases, even after doing the intensive swallowing therapy, they still aspirate, and that's when we recommend tube feeding.
So again, can you just mention the indication for tube feeding? I think this is very important.
Okay, so like what I said, when the patient has severe pharyngeal or oral dysphagia that doesn't allow him to take anything orally in a safely manner, that's when we tell the patient, you cannot take anything orally because it's not safe. You need tube feeding to get the food in an indirect way, directly from the tube to the stomach. We have two types of tubes, either NGT, which is, we call it short-term tube feeding, or the PEC tube, which is, we call it a long-term tube feeding. Usually we start with the NGT because it's short-term, on spot. When we see that the patient is not safe, we speak to the physician and the primary team, and we recommend NGT.
It's a bridge, okay?
Yes, it's like a bridge. And sometimes we keep that for a while and we start with the therapy in hoping that the patient will improve. If we tried all our methods or approaches and still the patient is aspirating or still having severe swallowing difficulty, that's when we start counseling the parents if it's a child, or the patient himself, regarding long-term tube feeding, which is the PEG tube. And we refer the patient back to the GI,
yes.
and the surgery for them to do the procedure.
Yeah, either it is inserted through endoscopic approach, or it can be done by ultrasound, under ultrasound guidance,
yes.
by interventional radiologist.
Yes.
So which one you prefer from your standpoint, big tube or nasogastric tube?
Everything has pros and cons.
Yes.
Exactly. So we don't say we prefer one tube over another. We really think about the patient and the situation and the parents and the home environment. So if the patient, let's say for example, there's no home care, there's no watcher in the house, no one will take care of the patient for the feeding, we might recommend PEG tube because it's easier for the family members to deal with than the NGT. NGT needs frequent change, frequent cleaning. So there's no right or wrong in this. It depends on the case, really.
Just to add what you have mentioned, maybe the big tube is for dignity of the patient is better because it's hidden behind the clothes.
Yeah,
like
and for hygiene as well, it's cleaner. No, socially, it's more acceptable, and it gives more confidence for the patient. So imagine an 80-year-old or a 50-year-old who's well known in the society, let's say, and he has a lot of social circles, and then he goes out from the hospital putting an NGT.
Sure.
On a psychological aspect, on a social aspect, we still look into that, and it's really important for us to keep that in mind when we decide tube feeding. So definitely yes, in that case, sometimes the patient himself will say, I want the PEG tube, although it's more into surgery, but they would say, for me, I'll be more confident with the PEG tube.
Excellent question related to that big tube feeding.
Yeah.
Can a patient with big tube can take orally?
Yes, very good question. Yes, depending on, let's say, the severity of the swallowing. Let's say, for example, dementic patients. We recommend sometimes PEG tube for them because they forget to eat. Their feeding habits are different. They have low appetite. They refuse to take anything orally. So nutritional nutritional point of view, yes, we tell them go for the PEG tube, but at the same time, if there's the family members around him or there's visitors, we don't tell them you can deprive them of coffee or tea or the social aspect of the social feeding. So they're on PEG tube for the main nutritional requirements, but also they can take orally for the social aspect of it. So
excellent.
As long as it's safe. Sorry,
as
long as it's
that's
safe.
really beautiful because just to reassure the family and the caregiver, they can enjoy or they have good quality of life.
Yes, even in pediatric we do this as well. So if there's a developmentally delayed child and we did that modified barium swallow study and he's only safe to take puree or like, let's say, spoon feeding, the very thick consistencies, we recommend PEG tube to take the food, the milk and the nutrition, all the nutritional requirements. But for the mother to feed her baby, she could just give him small amounts of puree or any kind of food that he likes.
Excellent. What are the most important precautions for, let's say, patient with big tube feeding or NG tube feeding or feeding through the oral route, especially for elderly? Is there any precautions like the should be supine, should be sitting, or should be any way?
We call it aspiration precautions. So we mainly educate the watcher and the family members about that. So we usually inform the patient or the family during feeding. The patient needs to be upright position.
Upright,
Yes, upright position, seating position during feeding or during drinking, especially drinking as well. Also, we recommend oral hygiene. before the meal and after the meal, because if the patient has oral dysphagia and there's weakness in the oral muscles and he's eating, there might be residues of the food under the tongue, and when he goes to sleep he might aspirate with it. So we prevent that by doing proper oral hygiene several times a day. Also, sometimes we recommend that the patient takes small size boluses, for him to be able to control it more and chew it better, instead of choking with it if it was a large bolus. Yeah.
Excellent. I think that before we conclude, we'll ask you an important question about trach-customized patient. What are the swallowing and speech, I will say precautions or management?
Okay, so this is a model for a trach patient. Regarding swallowing, we do exactly the same with the other patients when it comes to assessment. We assess the oral phase, pharyngeal phase. Not necessarily the patient has a trach, it means that he cannot take orally. A lot of patients who are on tracheostomy, they still can take orally, but we need to assess that first. So it's the same thing. Regarding speech, because the patient is on trach, it means that he's not using the upper airway. Inhalation and exhalation is through the trach, which means by that there's no air stream coming through the vocal folds and vibrating the vocal folds. So as a result, there's no voice. So that's where we come in. We have a device that's called the speaking valve. It's a one-way valve. We place it on the trach, which allows the airway to go inside but not out. So we redirect the air stream.
Thank you, Ms. Reem. Just in a nutshell, what's the take-home message of your very insightful interview?
So mainly my take-home message is for the parents. If you see your child has any swallowing or communication, which is speech language difficulties, please come visit us as early as possible to start early intervention. And for physicians, if you had any patient coming to your clinic complaining of any speech, language, communication, or swallowing, voice disorders, please refer them to us.
Thank you, Ms. Reem Mallawi, speech therapist, for such wealthy discussion about
Thank you so much.
disorder.
Thank you for having me in your episode.
It's
my pleasure. Thank you so much.
Now we are coming to the last segment of our episode. We'll be talking about health benefit. To watch more details about this report, stay with us. Welcome back to Elixir of Life. Now we are coming to the end of our episode. Before I conclude, I would like to thank our great team, and I wish you have enjoyed watching our episode and found it useful. Until next week, we wish you a pleasant week ahead. Assalamu alaikum wa rahmatullahi wa barakatuh. Goodbye. See you next week.